Welcome to a new episode of Sexual Education in Old Age. Today, we're diving into a topic that might feel delicate, but is absolutely vital for the well-being of men over 50, male sexual health in later life. As we age, our bodies and sexual experiences naturally evolve, but these changes don't have to diminish our quality of life. In fact, with the right knowledge and habits, this stage can be just as fulfilling, if not more so, than earlier years. Sexuality isn't a switch that turns off with age. It's a dynamic aspect of our lives that adapts, transforms, and continues to offer joy, connection, and vitality. If you're curious about how to nurture your sexual health and overall wellness as you age, you're in the right place. By subscribing to our channel, you'll unlock a treasure trove of advice, strategies, and insights tailored to help you thrive. Each episode is designed to empower you with knowledge, from tackling common concerns to exploring holistic approaches to well-being. Remember, prioritizing your health isn't just an act of self-care. It's a gift to yourself and those you love, fostering deeper relationships and a richer life experience. Aging is often celebrated as a time of wisdom and freedom, but it's also a phase where proactive health management becomes essential. Sexual health, in particular, is intertwined with physical, emotional, and social well-being. Yet, societal taboos often leave older men navigating these changes in silence. Let's shift that narrative. Today, we'll explore the realities of sexual health after 50, debunk myths, and highlight evidence-based strategies to maintain, or even enhance, your intimate life. Central to this discussion is understanding that challenges like erectile dysfunction, ED, are not only common but manageable. We'll also unpack the nuanced role of lifestyle factors, such as alcohol consumption, and how moderation and mindfulness can make all the difference. Erectile dysfunction, a window into overall health. Erectile dysfunction, the inability to achieve or sustain an erection sufficient for sexual activity, affects approximately 40% of men over 40 and 70% of those over 70, according to the Massachusetts Male Aging Study. These figures aren't just statistics. They represent a widespread experience that many men feel too ashamed to discuss. Yet, ED is rarely just a sexual issue. It often serves as an early warning sign of underlying health conditions. For instance, endothelial dysfunction, impairment in the inner lining of blood vessels, is a key contributor to both ED and cardiovascular disease. The penile arteries, being smaller than those supplying the heart, often show damage earlier, making ED a potential red flag for heart disease. Research in the Journal of Sexual Medicine highlights that men with ED are 1.6 times more likely to experience a major cardiac event within a decade compared to those without. Diabetes is another critical factor. High blood sugar levels damage nerves and blood vessels, impairing the complex interplay of vascular and neurological responses needed for an erection. A 2018 meta-analysis in diabetes care found that men with type 2 diabetes have a 3.5-fold higher risk of ED than non-diabetic men. Additionally, hormonal shifts, particularly declining testosterone levels, a condition known as hypogonadism, play a role. Testosterone supports libido, erectile function, and overall energy. Studies indicate that nearly 20% of men over 60 and 30% over 70 have clinically low testosterone, which can exacerbate ED. Psychological factors are equally significant. Stress, anxiety, depression, and relationship strains can create a vicious cycle. Performance anxiety, for example, triggers the release of cortisol and adrenaline, hormones that constrict blood vessels and inhibit relaxation, key for achieving an erection. A 2020 study in psychosomatic medicine found that men with untreated anxiety disorders were 2.1 times more likely to develop ED. The stigma surrounding aging and sexuality can further isolate men, compounding emotional distress. Breaking the silence. The power of open dialogue. The emotional toll of ED is profound. Men often report feelings of inadequacy, embarrassment, and fear of rejection, which can strain relationships and diminish self-esteem. Yet, silence only deepens these wounds. Normalizing conversations about sexual health is crucial. Partners who communicate openly about ED often find new avenues for intimacy, such as emotional connection, non-penetrative affection, and mutual support. Therapists specializing in sexual health emphasize the importance of framing ED not as a failure but as a shared challenge to navigate together. Medical professionals are also pivotal allies. A 2019 survey by the International Society for Sexual Medicine revealed that 70% of men with ED had never discussed it with a doctor, often due to embarrassment. However, healthcare providers are trained to approach these conversations with sensitivity and can offer solutions ranging from lifestyle adjustments to advanced therapies. For example, phosphodiesterase type 5 inhibitors, PDE5s, like sildenafil, Viagra, and tadalafil, Cialis, are effective for many men, enhancing blood flow by relaxing penile arteries. These medications aren't aphrodisiacs but facilitators. They require sexual stimulation to work. For those unresponsive to PDE5s, alternatives like vacuum erection devices, penile injections, e.g., alprostadil, or even surgical implants may be explored. Lifestyle modifications can also yield remarkable improvements. The Princeton 3 Consensus, a panel of experts in cardiovascular and sexual health, underscores that interventions benefiting heart health, such as smoking cessation, weight management, and regular exercise, also ameliorate ED. A randomized controlled trial published in the Journal of the American Medical Association found that men who adopted a Mediterranean diet, rich in fruits, vegetables, whole grains, and healthy fats, saw a 40% reduction in ED severity over 2 years compared to controls. Similarly, aerobic exercise improves endothelial function by boosting nitric oxide production, a molecule critical for vasodilation. Alcohol and sexual health, a double-edged sword. Now, let's turn to a topic often intertwined with social rituals and relaxation: alcohol consumption, particularly beer. The relationship between alcohol and sexual health is complex, shaped by quantity, frequency, and individual physiology. Moderate beer consumption, defined as up to 1 12-ounce serving per day for men, has been linked to certain health benefits. Beer contains polyphenol like xanthohumol, found in hops, which exhibit antioxidant and anti-inflammatory properties. A 2016 study in the American Journal of Clinical Nutrition reported that moderate beer intake correlated with a 20% lower risk of coronary heart disease, likely due to improved lipid profiles and reduced arterial stiffness. Since cardiovascular health is integral to erectile function, this suggests a potential indirect benefit. However, the line between moderation and excess is thin. Chronic heavy drinking, defined as more than 15 drinks per week, wreaks havoc on multiple systems. Ethanol disrupts the hypothalamic pituitary gonadal axis, suppressing testosterone production. A seminal study in the Journal of Clinical Endocrinology and Metabolism found that men consuming 5+ drinks daily had testosterone levels 18% lower than non-drinkers. Low testosterone not only dampens libido but also contributes to fatigue and muscle loss, further impacting sexual confidence. Alcohol's diuretic effect can also dehydrate tissues, potentially causing discomfort during intercourse. Moreover, alcohol is a central nervous system depressant. While a glass of beer might lower inhibitions and ease anxiety, excessive consumption impairs neural pathways necessary for arousal and performance. Acute intoxication can lead to whiskey dick, a colloquial term for alcohol-induced ED. Over time, neuropathy from alcohol abuse damages nerves essential for transmitting arousal signals. A 2021 review in Alcohol Research noted that 72% of men with alcohol use disorder reported ED, compared to 25% in the general population. Weight gain is another concern. Beer is calorie-dense, A typical pint contains 150 to 200 calories, often accompanied by salty snacks that exacerbate bloating and hypertension. Obesity fuels insulin resistance and metabolic syndrome, both linked to ED. Visceral fat, in particular, secretes inflammatory cytokines that impair endothelial function. A longitudinal study in the International Journal of Obesity found that every 1-inch increase in waist circumference raised ED risk by 10%. Yet, context matters. Enjoying a beer socially, in a relaxed setting, might enhance mood and connection, key components of sexual well-being. The key is mindfulness, savoring the drink slowly, pairing it with water, and avoiding binge patterns. For those concerned about calories, low-alcohol or non-alcoholic beers offer similar flavors without the same metabolic burden. Holistic health habits, beyond the bedroom. Optimizing sexual health in later life demands a holistic approach. Nutrition, exercise, sleep, and stress management form the pillars of vitality. Let's explore each. 1. Nutrition. The Mediterranean diet remains the gold standard, emphasizing omega-3 fatty acids, found in fatty fish, antioxidants, berries, dark leafy greens, and whole grains. These foods combat oxidative stress, a key driver of aging and vascular dysfunction. Zinc, abundant in oysters and pumpkin seeds, supports testosterone synthesis. L-arginine, an amino acid in turkey and lentils, is a precursor to nitric oxide. A 2020 trial in urology showed that men supplementing with L-arginine, 5g/day, experienced improved erection hardness scores over 12 weeks. 2. Exercise, aerobic activities, walking, swimming, enhance cardiovascular endurance, while resistance training preserves lean muscle mass, crucial for metabolic health and physical confidence. Pelvic floor exercises, often overlooked, can improve erectile strength by enhancing blood flow. A 2023 study in the British Journal of Sports Medicine found that men who practiced daily Kegels for 6 months reported 50% greater improvement in ED than those who didn't. 3. Sleep. Quality sleep is non-negotiable. During deep sleep, the body repairs tissues and regulates hormones, including testosterone. Sleep apnea, common in older men, disrupts this cycle and is strongly linked to ED. A 2019 study in sleep medicine found that continuous positive airway pressure, CPAP, therapy improved erectile function in 75% of men with obstructive sleep apnea. 4. Stress management. Chronic stress elevates cortisol, which antagonizes testosterone. Mindfulness practices like meditation, yoga, or even gardening can lower stress hormones. Cognitive behavioral therapy, CBT, is particularly effective for anxiety-related ED, helping reframe negative thought patterns. The role of medical check-ups and innovation. Regular health screenings are vital. Blood pressure, cholesterol, and HbA1c, a marker for diabetes, should be monitored annually. Testosterone levels can be checked via simple blood test, preferably in the morning when levels peak. For men exploring testosterone replacement therapy, TRT, benefits must be weighed against risks like polycythemia or cardiovascular events, as highlighted in a 2022 FDA advisory. Emerging therapies also offer hope. Low-intensity shockwave therapy, LIST, a non-invasive procedure using sound waves to stimulate blood vessel growth, has shown promise. A 2021 meta-analysis in the Journal of Sexual Medicine reported a 65% efficacy rate in improving erections. Platelet-rich plasma, PRP, injections, though still experimental, aim to rejuvenate penile tissue through growth factors. In conclusion, embracing aging with confidence. Aging is an inevitable journey, but how we navigate it is within our control. By embracing open dialogue, adopting evidence-based practices, and seeking support, men over 50 can reclaim their sexual health as a vibrant part of life. Remember, ED isn't a verdict, it's a manageable condition. Alcohol, enjoyed mindfully, need not be an enemy. And holistic health habits lay the foundation for enduring vitality. If this discussion resonated with you, please share it with someone who might benefit. Subscribe to Sexual Education in Old Age for more insights, and let us know your thoughts or questions in the comments. Together, we can dismantle taboos and foster a future where aging is synonymous with wisdom, connection, and unabashed joy. Thank you for joining us. Until next time, take care of your body, mind, and heart. They're the keys to a life well lived.